Hi, everyone. It's really a pleasure to be here today. My name is Christine Lovely. I'm a physician scientist at Vanderbilt University, a School of Medicine and Vanderbilt Ingram Cancer Center. My specialty is lung cancer. I treat patients with lung cancer in the clinic, and I study lung cancer in my laboratory. I'm really excited to tell you today about my funded research. This is a project that I feel very passionately about for all lung cancer patients, not just in the state of Tennessee, that's my home, but in the US and worldwide. So my project is about a type of lung cancer called small cell lung cancer. It's a less common type of lung cancer. It's about 15% of all lung cancers. But if you pause for a minute and think that 15% of a big number, so there's 235,000 new cases of lung cancer every year in the United States. So this really is a major public health problem. More importantly, there has been no change in how we treat small cell lung cancer for more than 3 decades. So there really is a very desperate and urgent need to try and find ways to diagnose this disease better, to detect it earlier, and to have better treatments for our patients. Really, in 2019, it is just not acceptable to have a treatment regimen that's 3 decades old. So our project that's been funded through my laboratory and that I have a great team of people working with is to really try to identify ways to detect small cell lung cancer earlier, to find patients who are at risk for this disease, and then to actually find ways to monitor how the tumor changes throughout the course of therapy. The therapy that we have for small cells is chemotherapy, and some patients respond very, very well to chemo, but the major problem is that the disease comes back. The tumor comes back with a vengeance and very quickly. And we want to try to understand how can we figure out why the tumor can be so responsive but then come back and be so aggressive and hard to treat. And so all in all, we're taking a very global approach to studying this very highly deadly type of lung cancer, or small cell lung cancer, by thinking about how can we detect it sooner, how can we identify patients who are at risk for this disease, and then once patients are diagnosed, is there ways that we can monitor the disease in a better way to help advance our treatment platforms. And actually, the project that we're working on has several different aspects of looking at mutations. The first aspect is, are there mutations that occur in your body in general that may put a particular person at risk for small cell lung cancer? So something that you're born with, something that's in your body, something that's in all of your cells that may make it more likely that you get small cell lung cancer. That's one part of our studies. Now, the biggest risk factor we know for small cell lung cancer is smoking, but we know that there may also be genetic or inborn mutations that can predispose to this disease as well, and we would like to identify those patients who are particularly high risk. The second part in how we think about mutations is, can we actually find mutations that are characteristic of small cell lung cancer in the blood? So our project involves the use of liquid biopsies, where we actually draw patients' blood when they're in clinic. So most patients get a blood draw in clinic anyway. We get a little bit of extra blood, and then what we do is we isolate DNA from that blood and try to find the mutations that are characteristic of small cell lung cancer. And we use those mutations to track, is the patient responding to therapy or not? So there's really 2 different ways we can use liquid biopsies. The first, and the one you're referring to, is what we call cell-free DNA, or circulating tumor DNA, where the tumor, as it grows, it actually sheds DNA, so it extrudes DNA from the cell, and that DNA starts floating around in the bloodstream, and we can actually find those small fragments of DNA. The way we use that circulating tumor DNA, also called cell-free DNA, is we use it to actually monitor how the patient is responding to therapy, and I'll give you an example. Right now, the biggest utility in my mind for liquid biopsies is to help to supplement imaging scans. So usually when a patient comes into clinic, they get a CT scan, and that helps us as physicians to understand, is their tumor responding to treatment or is it not? Well, we believe that liquid biopsies are a more sensitive way to actually identify when the tumor is coming back. And we've had several patients for which we've been able to identify mutations in the blood before there's any radiographic appearance of the tumor coming back, meaning we can actually find the disease-associated mutations in the blood before we see evidence that the tumor is growing on a CT scan. Now, the second component of liquid biopsies is something we call circulating tumor cells, and this is something we're really excited about in my lab. There's been a lot of work in small cell lung cancer looking at circulating tumor cells. We're taking a little bit of a different approach, though. We are isolating single circulating tumor cells using some very sophisticated equipment and using those single cells to try to understand what are the populations of tumor cells that are floating in the blood, what are the populations of tumor cells that are responsive to therapy, what are the populations of tumor cells that are not responsive to therapy, and that single cell resolution actually gives us the ability to ask these questions. And if we think about it for a second, what is the cause of death for most cancer patients? It's metastatic disease, and circulating tumor cells are by definition metastatic disease. And so we really want to understand the biology of the circulating tumor cells and couple that with the biology of the cell-free DNA to both diagnose the disease better, to treat it sooner, and to ultimately find ways to treat it better. So my lab studies non-small cell lung cancer as well, but what really drew me to small cell, and I think this is really the heart of how this grant has helped shape my research, is this is a type of cancer that we see a lot in the area of the country that I live in here in the South. And coupling the prevalence of the disease with the fact that outcomes are dismal and treatment has not advanced in so long, I felt very strongly that we needed to find a way to study this type of cancer using a different perspective. And we're very fortunate here at Vanderbilt to have our clinics and our laboratories very close by. And so that gives us the ability to collect blood samples from patients on a regular basis every time they're in clinic, because we have a close-knit team of researchers and people in the laboratory and clinicians in the clinic who all really share a passion for studying small cell and finding ways to make it better. Most patients don't live a year after they're diagnosed with small cell. Clearly, there is tremendous room for improvement and desperate need. And I think that from our perspective in my laboratory, we felt strongly that we needed to find ways to think about this tumor and how we could do a better job. Now, there are lots of great people throughout the entire world studying small cell and really a very rich community in this regard, and we hope that we can contribute to the body of work that's being done. And none of the small cell work in the lab would have been possible without the funding that we received. So I will say from this initial grant, we've already received a federal grant that goes over 5 years. So that's a huge bolster to the research program. But in addition to bolstering my own research program in my lab, it has also been really a foundation for starting other people's careers. So I have a PhD scientist in my lab who's working on this project and who's writing his own grants to study small cell. There's a wonderful young investigator who's now a new faculty member. He's a physician who studies lung cancer as well, who's been working very closely on this project, and he got his own training grant on small cell. So what we hope for any research project is that not only does it advance the science and advance the medicine, but that it also gets people excited about the area of research because they identify the need and they enjoy working with the team to try to bring together the expertise to ultimately, we all share the same common vision, which is let's help patients. All of our best research questions come from the clinic because you can see where the areas of most dire need are. And actually, whenever possible, I will bring patients up to my lab because I think it's also really important for patients to see what does a research lab look like? What are people doing in a research lab? What does it mean to be in a big academic medical center where they have cancer research? Most people have never been in a laboratory, and I think that, for me, it's very important for my laboratory team to understand how important the clinical need is, but also for my patients to know that we are doing everything we can, and not just we at Vanderbilt, but we across the world to really try to make headway in this type of lung cancer. The Ross Wonders, the EGFR resistors, the ALK positive, Amanda Nurstead, Stephen Huff. There are so many amazing, powerful advocates in the lung cancer world who have a very strong voice, and that voice is incredibly important to help advocate for lung cancer research, which we know that lung cancer is the most deadly cause of cancer in the world, but we also know that it's underfunded. And I think I would love to work with more advocates, and especially advocates in the small cell space. We just really don't have that many right now. And part of that is because The disease is so devastating, and I hope that as we, as a community, can actually find better ways to treat this disease, that we'll have more patients who are well enough to have a voice in this space, because that voice is so incredibly impactful.